Hold on, baby. Hold on. You ready? Hold on, baby boy, okay? We're going home. Going home, okay? Yes, we're gonna go home. Yeah, we're gonna go snuggle, okay? We're gonna go snuggle. Hopefully we'll beat the rain. Yeah? Hopefully we'll beat the rain. Go home and go snuggles. I can't see. Hi guys. Good afternoon. This is Tiffany, 100 Plus, with Mario. Much sooner than I thought I was going to be updating you guys, because we got some not so good news. Mario could not have his infusion today. Brought him in, they did his exam, and his exam was okay, but they rechecked his blood work because they checked it 3 weeks ago and he was put on the antibiotics for potential ear infection. So the neurologist, Dr. Sunil, wanted to make sure that he was okay prior to starting the chemo, and she ran his blood work again, and his white cells were very, very low. She called me. I could tell immediately in her voice. It wasn't like my normal phone call, like update. You know, she started out, well, just, you know, his exam was okay, and I'm like, but what's wrong? And she said last time he was there, which was just 3 weeks ago, his blood cells, his white blood cells were at 6. And today when they rechecked him, he was at 3.9. So that's very low. The normal is 5 to 16. And it's thousands. Sorry, I'm talking in thousands, not just single white blood cells. The normal white blood cell count for a dog going through what he's going through is 5,000 to 16,000 count. His count last time he came in 3 weeks ago was 6,000, which was already on the low end. Today, when they rechecked him, he was at 3,900. So, really low. And she called me to discuss it. We went back and forth several times on what route to go. You know, I am a very nervous helicopter mom, so I'm nervous about pushing off his Cytosar for another week, because if he relapses, he could lose the vision in his good eye. So I'm always very, very concerned about that. Or, you know, the disease can progress to a point where we can't slow it down, you know. But on the flip side of that, his white cell count was already so low today that if they gave him chemo, it would drop dangerously, even more dangerously low. And then he is very susceptible to a myriad of things where, even though he doesn't come to the rescue house with me anymore, and I don't go to the rescue house, it doesn't mean he can't pick up outside germs. I mean, we don't have a fenced-in yard, so we have to walk. There's other dogs in the neighborhood. So he could potentially pick up something outside that then his body would not be able to fight off. And it could be of life and death, or it could be something as simple as his white cells drop even more than they are now, which can make them feel kind of crappy and nauseated. And if he vomits, then we have an issue where he could potentially aspirate because he is a Frenchie, and then he wouldn't have the strength to be able to fight a potential pneumonia, aspiration pneumonia, or anything like that. So it was a lot of back and forth with me and the neurologist. I changed my mind like 3 times on the phone call, and then I basically just left it up to her. She is the neurologist. She knows best. She sees him. She sees his case. She knows his history. She said she would feel better pushing the Cytosar out a week, giving his body a chance to replenish the white cells before they deplete them again with the chemo. She said, every neurologist does Cytosar differently. In her experience, she always starts off her patients at 4 weeks. She never does them at 3 weeks. So we went into the whole history of Mario and trying to get him out to 4 weeks and what happened. And he had a little bit of a relapse. He was slipping in the 4th week. But that was also very early on in his treatment. So she was pretty confident that she thought he could go to 4 weeks this time and be okay. And that would be the lesser of 2 evils then. Giving him the Cytosar today, starting him back up on antibiotics, which he just got off of, to help alleviate potential infection, which can come from anywhere, anytime. So, again, it was a lot of back and forth. We were on the phone for quite a while, and then I thought I had made up my mind that I was going to have, I didn't want to take the risk of him relapsing, so we were going to go ahead with it, and then I ended up changing my mind again and went with her suggestion. So he did not get his Cytosar today. Obviously, I picked him up. He's laying down in his car seat right now. He's getting comfortable. So you probably can't see anything other than his butt because he's kind of laying down in his car seat. But so he didn't get it today. He is rescheduled for next Friday. I am going to be watching him like a hawk during this week. Not that I don't already, but even the slightest little change in him, I will have to figure out a way to get him back up there if need be. And she said that, if I notice anything, if anything goes wrong, if there's anything like that, she's like, we're here, you can bring him, we'll do the Cytosar, we'll get him whatever he needs. And she is, of course, on shift next Friday as well, so she will be his doctor next Friday, and she will double check him again. She'll take his blood again to make sure that his white cells have regenerated enough, that he is strong enough to have the chemo. I asked her what could cause them to drop. Is it only an infection, or could it be the disease? She said the chemo itself, of course, drops them, because that's what it does. But his body could also have been fighting an infection, which we knew he was. He had an ear infection. She said sometimes urinary tract infections can drop white blood cells, but he hasn't had any kind of symptoms or signs of a UTI. He is not peeing any more than he usually does. He's not having any accidents. said it is probably just that. His body was really fighting, even though he was on antibiotics, his body was fighting the infection, and it depleted his white cells. And he also had chemo 3 weeks ago, so that depleted them. And his body just hasn't had a chance to replenish. And she really didn't think that it was worth taking the risk to do the Cytosar today and have them drop even lower, and then have him get sick either from an outside source or just sick because he feels so crappy that they're so low. And then we run a risk of a bunch of other very potentially serious complications. So no treatment today. We will go back next Friday. He will have blood work taken again, and hopefully he's good, because we cannot push it off more than that. So he will have to have it next Friday, whether or not his white cells have really bounced back or not. So to say that I am a little tied up in knots and nauseated over the whole situation would be an understatement. But I trust his doctors wholeheartedly. They have been taking great care of him for over 3.5 years now, and I trust them. So that is why I went with her suggestion and put it off for a week. Right, Mr. Oh, I love that face. I wish they could see that face. It's so cute. Back there. He's all hidden behind the seat. Yeah, I'm sorry. We did not need 3. I do have all of the links to donate on this video. Again, we didn't raise much on the first video, and even though he did not have the Cytosar today, we still had a bill. He still had an exam, he still had blood work, and he was hospitalized for a couple of hours. So we did still have to pay a couple $100 bill today. And then next Friday will be his regular bill, because actually it'll be a little bit more expensive because they're going to want to do blood work again, which is an added cost. So I do have the donate button on this video, and I have all of the links. I know on the first video some people had said they were having problems with the donate button, but then I saw within like an hour or so people were able to donate. So hopefully there won't be a problem with this video and the donate button. If there is for some reason, if you can just come back to the page in an hour or later tonight and try again, I would be very, very grateful. Again, he will be going back next Friday for the treatment and blood work. So it was a little bit of a curveball, not expecting this today. This is the first time, I believe, that he has been turned away from the treatment. I mean, he's had to go a couple extra days because he was, he had kennel cough or an eye infection. We would put it off a few days, but he's never actually gotten there for treatment and been turned away. So it's a little taxing on the heart and the brain. So, all right, it's starting to rain a little harder, so I'm going to sign off. Thank you all for your continued love and support. I will keep everybody updated. Hopefully you will not see me until are so grateful for that. So this is Tiffany and Mario, who is very comfortable in his seat back there. Or if I can take this off and just shift it. There. I don't know if you can see him. I'm not really looking. I'm just trying to maneuver it because I'm driving. But hopefully you can see him a little better at this angle. He is resting quite comfortably at the moment. So thank you guys very much once again for all your continued love and support. This is Tiffany and Mario, 100 Plus Abandoned Dogs of Everglades, Florida.